Hi everybody, this is Dr. Mandy, and I recently had a request to talk about how to put hearing aids in your ears. If you've ever gotten hearing aids before, it can take some practice to get them in your ears correctly. Sometimes a mirror works, sometimes it confuses people. So I'm just going to do a generic video today on how to put your hearing aids in your ears if you're still kind of struggling to get them in a little more fluently. I have a few styles with me. This one is kind of a bigger hearing aid that's custom molded to the ear. So I'll demonstrate how to put this one in your ear. I also have a smaller one. Sometimes these get a little trickier to get in your ear because they go in further. And then I have probably the most common style of hearing aid that most people have, which is this receiver in the canal hearing aid. So we'll start with the first one, the full shell. These tend to be a little bit easier because you have a little more surface area to grab the hearing aid. But for starters, you'll see a little mark on each of the hearing aids. This is usually where the serial number is for the manufacturer, but it's also color-coded. So red is your right ear, and then blue is your left. So red, right, RR, that's a good way to remember. And the other thing with custom hearing aids is if you're looking at your hearing aids, your ear canals go in. So if you're looking, the canal faces your nose, that means this is the right ear, because you can't put a left hearing aid in the right ear when you have custom hearing aids. Okay, so the easiest thing to do with these full shell hearing aids is usually the volume control, this wheel, is below the battery door, which is right above it. So you just want to make sure that battery door from the top down, volume control. You want to turn the hearing aid and put your finger on the top and your thumb on the bottom. So I got to take out my hearing aid, but I'll show you how to put it in. A lot of people want to twist and turn once they get it up to their ear, but the best thing to do is just bring it straight up, kind of find the opening into your ear, and just push the hearing aid straight in. You don't need to twist and turn. If the hearing aid isn't going in as fast as you want it to, another trick is to pull on your earlobe. Because when you pull on your earlobe, it straightens out your ear canal. And see, the hearing aid goes in your ear. So these, then to take it out, you just kind of grab at the top, get your finger on it, and it pulls straight out. So the other style is a completely in the canal hearing aid, and a lot of these smaller customs have a retrieval line. And what I tell patients is the retrieval line always is at the bottom of the hearing aid. Again, red is right. If you hold the retrieval line, don't twist your wrist, bring it straight up, you can push it straight in your ear. If you're still kind of stuck, you can just pull on your earlobe, and that straightens out your ear. And you can't push these in too far, because when these get molded, they are molded to a point where you can't push them in too far in your ear. So don't be afraid to push these in your ear. Okay. And the next style a lot of people have is this receiver in the canal hearing aid. Now, a lot of patients want to put the receiver part in their ear first, and these get kind of flimsy. So the best thing that I recommend is to just slide the hearing aid up over your ear first. So if you slide it over, and a lot of patients start doing this, where they get their other arm. We don't need to bring your other arm in. If you just bring it forward and use the hand on the same side, you can now push that hearing aid down in your ear. And some patients have these little retention wires. Some products don't have them, some do. But if for some reason you don't have one, or the audiologist took it off, that's fine too. But there is a purpose to these. These actually keep the hearing aid in your ear. So when you put this in your ear, once you get this wire flushed against your head, this little tail just sits down in the bowl of your ear. And if it's a brand new hearing aid, it will curl with your body heat and curl back within a day or two. So there is a purpose to these retention wires. and there's always the last thing that you put in. So if you can get this over your ear and then the wire against your head and in, and then that wire will naturally go in your ear. And don't be afraid to pull on your earlobe. That really helps too, to straighten out your ear canal. So I hope this video is helpful for those of you that are having a little bit of trouble to get the hearing aids in your ear. If you have any questions, please call my office. It's 605-306-3050. Good luck and have a great day. Thanks. Bye.